Putting one foot in front of the other. That's how most people face life's challenges. Tracy Bradley is no different. But for her, the challenge in the past few years has literally been putting one foot in front of the other and enjoying what most of us take for granted, a simple walk.
I have a spinal cord tumor, a non-cancerous spinal cord tumor inside my spinal cord with an attached dermoid cyst, and the cyst keeps reoccurring. So I've had 3 major surgeries.
Until 5 months ago, when Bradley started physical therapy on this complex-looking machine. It's called LiteGait, a partial body weight support treadmill training system.
We have a harness that we put on the patient. We hook them up to an apparatus and it lifts them up. We then put them over a rehab treadmill and it allows us to take some of their body weight off while we can move their feet for them and work on their gait deficits and strength.
Varney Slyke says 8 patients, including Tracy, are rehabbing on LiteGait at Tamik. Bradley rehabs 3 times a week and says after her first 3 sessions, her hope of independent walking was renewed.
When I was getting off it and going home and noticing that I was able to bend that knee as I was walking, and my feet were really paying attention to where they were going, and it's all the connections were starting to be made again.
After a patient is securely strapped to the machine, it begins to lift the body a bit from the ground. Varney sets an adequate beginning speed, the treadmill is activated, and patients slowly begin walking. At first, a therapist helps move the legs and feet. Then patient independent mobility kicks in.
It retrains the brain. So there's certain pathways sometimes that get messed up from the brain all the way down to the muscles. And what it allows us to do is basically practice makes perfect. If we can practice the normal gait pattern and get them walking again, that's how we go about doing it.
She keeps working on her mobility by walking with a cane. When she first began, she confesses rehab was certainly no walk in the park. But step by step, it will be.
My goal is to get back to using my cane in my everyday life and in my home and in my office not using anything.
Sean Cunningham, News Source 8.